Empyema thoracic conservative management by closed tube thoracostomy. Introduction. The word empyema means presence of pus in the natural cavity. Empyema thoracic means pus in the pleural cavity. The term also covers pus in positive pneumothorax space. Diagnosis is confirmed by examining the pus spraying pleuron's obivity. The diagnosis, if it clear predominance by polymorphous microscopic examination, point to the diagnosed empyema is divided into acute and chronic type. The term chronic being used when organization has reached the stage of the pleural fine formation, progressive or parapneumonic fluid to formal empyema should be considered as medical failure. A parapneumonic fluid is clear and sterile. It has a low white blood cells count and low LDH. Glucose and pH are normal. Hippocrates recognized the condition and treated in the surgical drainage by the 19th century despite treatment of pleural aspiration, underwater seal drainage, and rib resection. The condition remained fatal, and so it was Sir William Osler in 1919. Those who survived, like King George, we had endure and pleasant protected illness. Availability of antibiotics has resulted in relative freedom in privileged part of the world. The condition remaining common in developing country, there are two basic principles for successful treatment. Number one, control of infection with appropriate antibiotic, the prescription of which depend not only on knowledge of antibiotic use for the diagnosis, influence of predisposing factor and age of the patient, but also an adequate laboratory help which should not only provide information about the infected organism but also their sensitivity to available drugs. Number two, adequate drainage of pus by thoracentesis, closed thoracectomy, rib resection, or open drainage by fenestration, decortication, and thoroplasty, depending upon the stage of disease and condition of the patient. 22 patient male and 9.49 percentage female forming of total consecutive admission in the Department of Chest Disease Divisional Headquarter Hospital Faisalabad during the period of 1 1995 to where treated the closed tube thoracectomy pathogenic diagnosis was in the absence of adequate laboratory help.